The following program is sponsored by Jewish Federation of Palm Beach County and the generous gifts of these contributors.
Thank you for joining us for our 44th season of Mosaic. I'm your host, Susan Shulman Pertnoy. Mosaic is Jewish Federation of Palm Beach County's weekly news magazine, exploring the most critical issues facing Jews here and around the world. Today, we're talking mental health, an issue that affects all of us on a daily basis. Our guests are actress, author, and activist Mariel Hemingway, whose personal struggles and family history shine a bright light on the issue. And we'll hear from experts from Alpert Jewish Family Service about the incredible help available to all members of our community. We'll be right back. We're so proud to celebrate our community visionaries, donors who contribute $1 million or more, serving as an inspiration for all of Jewish Palm Beach. Did you know that you can now enjoy Mosaic on the go? Listen to the Mosaic podcast by scanning the QR code on the screen or find it wherever you listen to podcasts. Joining us today is Mariel Hemingway. She's a guest in our community of Alpert Jewish Family Services to talk about mental health. Welcome to Mosaic. It's a pleasure to have you here with us today.
It's a pleasure to be here.
Mariel, your name and your family's name is synonymous with incredible creativity and talent, yet you're also well known for struggles with mental health issues, and You're very open about it. Can you tell us a little bit about your childhood, growing up Hemingway?
Well, I think, it was extraordinary in many ways. I grew up in Sun Valley, Idaho, Ketchum, where I live today. And it was a wonderful kind of cocoon. Like, the nature was so grand and so beautiful, and I can see why my grandfather loved it so much, my grandfather Ernest Hemingway, and why my father too loved Idaho. But again, my family did struggle with addiction issues. There was a lot of drinking in our home. And that caused a lot of friction, and it was because people were not dealing with the problems that were underlying. The alcohol was, self-medication for the issues that they couldn't talk about, and it was also the 70s, and late 60s, early 70s, and nobody talked about anything anyway. So it was a challenging environment to be a child in, although at the same time, it was the only thing I understood, right? They're your family and you love them, right? So you accept them for who they are and what they are and how they are. But it was, I definitely had some moments in my childhood where I was, picking up glass from a party the night before, and my parents getting into a fight, and somebody threw a glass and my mother's bleeding, and there were issues like that caused me to decide at a very young age that I was going to be the fixer. I was going to be the person that came in and made it all right for everybody in the family. At age 7, you do that. So I made this sort of decision that I was going to make everything okay, even at that young age, and it carried on for many years.
Yeah, that's very adult-like behavior for a 7-year-old.
Well, I think that there are many children out there that their survival instinct is to take on the role that's going to help them survive the best. The problem is we take that survival role that we have as a child and we carry it on into our adulthood. And it's probably what my own family did. They were probably adjusting to their own kind of addictive behavior of their own parents, or lack of communication, or whatever mental imbalance they were going through. And that gets carried on until you do the deep work about understanding yourself and understanding that we don't have to, as adults, carry on doing the same thing, right?
Right. When did you first discover that you suffered from depression?
It was very interesting because I thought that I was handling everything really well, because I was just determined to not let myself be like my other family members. I didn't drink. I tried to eat healthy. I did all kinds of crazy stuff, like not always healthy. I thought they were at the time. But I realized long story, but I got married. And I was in this relationship, and because it was better than my own family life, I thought, oh, this is great, I'm fine. And whatever problems we had, I just assumed that there was more work to be done on myself, more. I'm getting to the answer to your question, by the way. And then when I finally left that relationship after 24 years, I realized I'd been depressed most of my life. And it wasn't until I wasn't depressed that I realized that I had been depressed. Now, I went through a period of having suicidal ideation as well. That was a brief period during my marriage, and it was kind of the peak of right before I decided to change. I realized that I just needed to get out of an unhealthy relationship that I wasn't able to communicate who I was. Anyway, when I got out of that relationship, and my current relationship, which I've been with my partner now for 14 years, it was a day. I have done a lot of different things. I've done brain training, I've done neurotherapy, I've done all kinds of different things to get to the core of what I needed, right? And after doing several different kinds of sessions, and my partner had introduced me to, I looked at him one day and I went, wow, I think this is like the third week in a row that I woke up happy. And he said, well, that's the way you're supposed to be. You're supposed to be, it's okay. I mean, it wasn't like joyous, but I was like, oh my gosh, I'm fine. Like I kept being fine. I kept waiting for the shoe to drop, right? I was like, when is this gonna happen? I'm gonna be sad and depressed. And it just wasn't happening. What I realized is that that finding of your solution, and it's unique for everyone, right? And that's what I love about JFS, is that they provide all kinds of different modalities to help somebody get to their okay, to their recovery. And it is specific to each individual. So anyway, I found that, and I continue to this day to be incredibly healthy and happy. Like I have down days like anybody does, but it's not like I'm not in a kind of depression. And my depression was more, it was like a low-grade fever. It was kind of like just always
every
there.
day.
Yeah, but I didn't know any, it was kind of like my childhood. I didn't know any different because I'd been depressed when I was a kid. So anyway.
We don't have time for much more, but I want to ask you, if somebody's in the audience is watching and is struggling with some mental health issue, what would you suggest to them?
I think for most people to understand, number one, that they're not alone. Like there's so many people out there struggling, right? So you're not isolated. This is not your problem alone. It doesn't mean it is not painful and unique to you, but you are not alone in the struggle of being in pain right now, especially right now. And if you need help, you need to reach out. You really need to reach out to somebody that you feel safe with, comfortable with. I mean, that's what is so wonderful about this agency, is that they are helping people to find the solution that works for them. And so reaching out is not a bad thing. There should be no shame involved in that or embarrassment. There's still a little bit of like, I don't want to talk about it. It seems like, oh, and as a parent, you think you did something wrong. Mental health is not different from physical health, and we wouldn't give a cancer, we wouldn't, think lowly of a cancer patient or somebody with heart disease. If you've got a mental health problem, let's all address it. It's okay. I've been depressed. I've had suicidal thoughts. It's okay. No big deal. And there's recovery, because I know for a fact there is, because I feel the way that I feel.
That's fantastic advice. And by the way, it's amazing that you found something to help so many people heal, and in the same process, be able to help yourself.
Yeah.
So thank you so much for joining us today.
Thank you. Thank you for
and
having
the work
me.
that you do.
Thanks.
Coming up next, we'll talk with the leaders of Alpert Jewish Family Service about the mental health crisis here in the Palm Beaches. Stay tuned. We're so proud to celebrate our community visionaries, donors who contribute $1 million or more, serving as an inspiration for all of Jewish Palm Beach. Welcome back. Joining us now is Mark Hopin, CEO of Alpert Jewish Family Service, and Dr. Elaine Rotenberg, Chief Clinical and Impact Officer of Alpert Jewish Family Service. Welcome to Mosaic.
Thank you, Susan. Thanks for having us.
We just had an enlightening conversation with Mariel Hemingway, who you brought in for No Excuse for Abuse event. Mark, tell us what the top mental health issues are today facing us in Palm Beach County.
Sure, Susan. Since COVID was bad for everybody, and during that time, we did notice that there was, and Mariel actually mentioned it, a lot of impact on children and families. And we noticed within that was that there was problems with suicide, problems with addiction, and problems with just mental health just in general. In particular, kids were used to being, kids and teens used to being at school during the day, and then they found themselves at home during the day and dealing with those kinds of changes in their lives, as well as with the ideas of missing certain lifetime events like a graduation or a bar or bar mitzvah, and that's created some challenges that they never had to experience before.
Elaine, do you have anything to add to that?
Whatever kids experienced during the last 3 years or so since the pandemic, as Mark was saying, for sure was exacerbated by some of the isolation. And also we can't forget about the fact that all of the grown-ups that experienced losses, people that died for
Alone.
Right, but these were grandparents for those kids. These were parents for some of these kids. So the time was unsettling for everyone. Kids are no exception.
That's true. I understand that in addition to direct services, you provide outreach and engagement for mental health issues. Do you want to discuss that?
Sure. We have a program that we actually started, I guess 5 years ago now, Mental Health First Aid, which is an international program that Jewish Family Service actually brought it to South Florida. And we've created a county-wide coalition that has trained over 7,000 people in our county to recognize potential mental health or addiction signs and symptoms of a potential crisis. It teaches folks really a very specific 5-step response for how to approach somebody, get somebody to the help that they may need, check in about whether they're thinking of hurting themselves. It really helps destigmatize issues related to mental health.
It's amazing that you have such a holistic type of organization. Really is.
Yeah.
Speaking of that, you also do career counseling. How is that? You don't think of that in terms of mental health. Do you want to address that, Mark?
Sure. So we are fortunate. We have an agency called Career Connections. So that is a partnership with the Jewish Federation. And so when we come in contact with somebody that we think can benefit from career services, we make the referral and have them engage with Career Connections. They also provide some financial counseling as well, go through their budget to try to see if they can find some savings in their budget. And so Career Connections is definitely a piece of what we're able to do in terms of what Elaine was talking about, right? We may still want to see if we'll take on a care manager perhaps to help them with some other pieces of their lives, like with their children or with food needs, or perhaps there's a parent or a grandparent that is also can use some help that will help them live their lives better.
And then when they start to, let's say we're able to help get them connected to employment, then it's remarkable that they're starting to feel better and they're feeling more motivated, and then they're feeling less depressed. And it's hard sometimes to know exactly which area comes first. That's why you have to look at the whole picture. If somebody's working with the psychiatrist and you've gotten them on the right medication for their depression, all of a sudden they're able to feel more motivated, and now they can follow through on what the career counselor is saying when she says, work on your resume. Now they've got a little more motivation to be able to do that because their energy's back a little bit. So it all kind of goes together.
Yeah, it's really amazing. A lot of people have a perception that Palm Beach County is a wealthy community, but Jewish Federation recently did a study and I'm going to read you the statistics. It found that it's not the case, so shocking. In the broad community, more than 184,000 people face food insecurity every day. And 1 in 5 local Jewish households describe themselves as getting along nearly poor or poor. How is JFS addressing food insecurity?
Yes, that is one area that we are right in the middle of expanding our services around. We currently have 2 smaller food pantries, barely a food cupboard. In that enrichment center that I was talking about in Boynton Beach, we're building out a 1,500 square foot food pantry. It's going to be shoppable, kind of like an IKEA, come in one door, come out the other. We never had a refrigeration or fresh food before. The new food pantry is going to offer that service as well. Or offer those products as well. But what's going to be unique and where our focus is going to be is on, again, younger families or individuals. It's something called the ALICE population. It's a term coined by the United Way. It's the asset limited, income constrained, employed. And so we feel like that if we can meet those people and get them to accept some care management, some career connections, depending on what other things are going on in their life, counseling, or some kind of group service, that we'll be able to, over some reasonable period of time, make them less asset limited, less income constrained, perhaps better employed, and where they are not requiring the services of our food pantry anymore.
And it's so important what you just said in terms of the community's statistics and misperceptions, because it is true that term was coined by United Way. We've estimated that we think in our Jewish community there are as many as 10 to 15,000 households, Jewish households, that maybe meet this ALICE criteria. Yeah. And
wow.
So part of having these kind of conversations and you giving us this opportunity is to really, really help get rid of some of that stigma and the shame that I think Mariel had mentioned earlier as well.
Yes. Thank you very much for joining us. We have to take a quick break. Stay tuned for more important information from Dr. Elaine Rotenberg, including how and where to get help. That's next on Mosaic. Did you know that you can now enjoy Mosaic on the go? Listen to the Mosaic podcast by scanning the QR code on the screen or find it wherever you listen to podcasts. We're so proud to celebrate our community visionaries, donors who contribute $1 million or more, serving as an inspiration for all of Jewish Palm Beach. Welcome back. We're talking with Dr. Elaine Rotenberg on the state of mental health in our community. I've heard you speak about the shadow pandemic. What is that, Elaine?
We're in it, Susan. Let me explain. When we started dealing with this pandemic, which was 3 years ago now, which is remarkable, everybody was concerned at the beginning about how you were going to catch it, where you're going to get sick, what you did to manage your food, your groceries, all that, the very, how do you catch the virus kind of stuff.
Right.
And early on at that point, there was a lot of literature that had been written about the fact that what we really had to start being concerned about what was going to happen in the months and the years after the onset, in something that was started to be referred to as the shadow pandemic. And the concern was that there was going to be this later pandemic that was going to affect the social and emotional and mental health of folks that had lived through this early onset of the pandemic. And in fact, we are there. All of the talk of who your frontline workers are, well, we have frontline workers today. The frontline workers are the mental health professionals. We're past the, people aren't, washing off their tomatoes with Lysol anymore, right? We're done with that. But now there are other implications of what's happened by 3 years of death, of loss, of isolation, of lack of social skills, of fear,
And job loss.
And job loss, and prices going up, and add in some school shootings and all kinds of things that have really compounded our well-being from a mental health perspective. So it's a very challenging time for people now.
Yeah, and also there's an increase in mental health issues with teens and suicide. You were talking about this earlier. Suicide in teens and young adults.
Right.
How are you dealing with this?
Well, let me, just to give you a little sobering picture, before the pandemic, in 2019, there was a youth study through the CDC that looked at the 10 years from 2010 to 2009 to 2019.
Right.
And during that period of time, there was a 40% increase. And by 2019 in this country, we were talking about, and the headlines were talking about youth mental health crisis. That was before the pandemic. So just to put that in perspective. Now, since the pandemic, there have been all kinds of studies and we're really in the middle of looking at this, but I can tell you that just since the onset of the pandemic, we now have 119% increase in accidental overdoses. Suicide has now become the second leading cause of death in our 13 to 18-year-olds.
Oh, that's horrific.
Right.
How do you deal with this?
So, well, at Jewish Family Service, how we deal with it is we have a variety of direct services, of course. So we've really expanded our capacity to do telehealth. We've also expanded our work in terms of children's mental health. We've added to our team another therapist that specifically works with kids. And the other piece, in addition to the therapy, is that we're offering at no cost to the community an online support group for parents who are just how do you deal with ... And that's, they can look on our website and have information about the groups and stuff, because people are struggling. We also realize that it's not always easy to find a mental health professional or to get somebody to the therapist, right? So we're doing a variety of outreach things as well. We have, I think you and I have talked before about our teen dating abuse prevention program, where we train teens to teach other teens about
peer-to-peer,
about healthy relationships. So this year we are adding a mental health component to it. We have it's actually some funding from JFNA that we've recently received to create a teen mental health roundtable for our community.
Wow.
And so that's pretty exciting. And those are sort of more peer-to-peer, as you said, peer-led kinds of things that don't exclusively require professionals. So a lot of outreach into the community.
Why is peer-to-peer so successful? Why is that such a
With
great...
kids, it's a great thing because we know that, I think the number was something like when we talked about it with abuse, I think we found that 1 out of 6 teens says and reports being in an unhealthy dating relationship, but only 1 out of 25 will tell a grown-up. Right.
Wow.
So, yeah. So, and we know that, we also know developmentally that kids at a certain point kind of shift and talk more to their friends than they do to their parents.
That's true.
So,
Parents are usually the last one to know.
last to know. So, yeah.
But these statistics are so frightening about the teen suicide.
Right.
It's really, it's horrible. If you're a parent or a grandparent watching right now, what would you advise them to do?
So what I would advise them to do, first of all, is they could, if they wanted to, they could take a mental health first aid class, which is a long class. That's an 8-hour class. But if they want, we've just rolled out what we're calling mental health minis, which are 1-hour classes. One is on stigma. One is on mental health is everyone's business. You can do it at your card group. You can do it any place you want. And it is really just to educate people as to how you might approach somebody, some of the warning signs, to help by giving reassurance, not give advice. What we want to do is create hope for people, because the biggest predictor of depression and suicide is hopelessness. And so what we want to be able to do through this outreach, through letting people know that there are supports, there are ways to approach somebody. You're not going to make somebody think about hurting themselves if you ask them about suicide. You're going to help them feel that they're seen. We just want to see people.
As we wrap up today, what would you recommend to somebody in this community who's out there and says, I want to make a difference? What would you say to them?
I would say to them, first of all, anybody that wants to can reach out to us if they want to volunteer, become part, and learn more about how to get the message out that nobody should feel ashamed or feel embarrassed to ask for help. That there is no stigma, whether it's a mental illness, whether it's a disability, whether it's addiction, whether it's domestic abuse. How you make a difference is by not making somebody feel less than for what it is that they are dealing with every day that is a struggle for them.
Elaine, thank you so much for all that you do. You do remarkable work. Thank you for joining
Susan.
us today.
It's good to see you.
Same here.
Thanks.
This program is sponsored by Jewish Federation of Palm Beach County.